What's up, everybody? Steve the Hurricane here. As always, I'm going to go ahead and say, I feel like this is my thing that I always say, right? What's up, everybody? It's Steve the Hurricane here. I am so excited to be working with you and going over today's lesson, right? That's my saying. That's how I start off everything that I do. And the reason why, I'll tell you, I'm so excited about everything that I do is because it is a true honor and a blessing to be able to serve all of you. You know, as of right now, today, I have 179 active clients. All of you who are watching, those of you who will watch the recording of this, there's 179 of you. And even on my worst day, where everything seems to be going wrong, it really is an honor to be able to serve you, to be in the position that I'm in, to be able to help you when I have these meetings. I had a meeting a little while ago, literally. I ran upstairs. I'm in my basement office. I'm working from home today. That's why I'm wearing my Goku Dragon Ball Z Ultra Instinct shirt right now today. But I had a meeting with one of my coaches, and it was a personal consultation just to kind of go over where are you now from where you were when you started working here, and a bunch of stuff. And it was a very positive meeting because she's doing a lot of great things for her clients, and being able to share your testimonies of her experience working with you and what she's done in your organization. And that's what we do. And you know, when I hear this, and then every once in a while, you know, you get somebody who's having challenges and having a hard time executing, and hey, that's okay. You know, or somebody has a wild year where something terrible happens, and I call it, whenever somebody has that wild year where it's just bad thing after bad thing after bad thing, I always say that was the, you know, you shattered a mirror year, right? And everything that you thought was going to go one way didn't go the way that you thought. And we help you guys, our clients, through it. And so again, you know, that's why I'm always excited. I personally, I'll share this with you. I know many of you know that I'm a person of faith. I am a minister, right? This is a house of the Lord. So you see my little sign that I have here, Proverbs 3:5, and I remind myself all the time that, you know, I trust in the Lord with all of my heart, and I do not lean on my own understanding, right? So things that are going to happen that are beyond my comprehension, things that are going to happen that are beyond my control, I can't do anything about that. So I'm just going to trust him because he's gotten me through everything else in my life. And so I want you to know that I'm continuing, here I am, I'm helping you to grow your business, and I'm training you. I'm continuing my own training, and I actually started a ministry course that I'm in the middle of. And this right here, it looks like a lot of mess, but this right over here is what's called an oikos map, which is a prayer map. And it's all the people that I am praying for. And I didn't even get a chance to do this half of it over here. There's so many people that I'm praying for, but all of you are all here. And I pray for you guys, and I pray for your businesses. I pray the Holy Spirit over your businesses. I pray for your successes. I pray for your caregivers to be able to fulfill their mission and taking care of your patients and having meaningful work experience during their time with you, whether it's a couple of weeks, a couple of months, a couple of years. I pray for your patience, and I truly know that we reap what we sow, right? And so if you're out there and you're sowing your business to grow your census and take care of more people and fulfill the mission of caring for people to keep them home and out of the hospital safe and sound, may you also earn an amazing income while you're doing that and taking care of those people at the same time. So that's my prayer for each and every one of you. And I just wanted to start off by saying that to all of you. So if you're having a rough day, if you had a rough year, just know that at least if there's nobody else, I'm praying for you. I'm pulling for you. I truly love you guys, and I care about you, and I think about you all the time. And so with that said, this session right here, this presentation is you know, when you have been in my classes, you've been a part of the Hurricane University, many of you, some of you aren't yet, and that's okay. I know some of you are Home Care Evolution Daily and you're getting it, but most of you have been through the Home Care Hurricane University, and you've been in the live classes with me, and I've been training you on so many things on how to execute and scale and grow your business. And then many of you have been receiving all these magazines, right? And I want to show you one, right? This one right here. This one is coming. It's coming. You know, just as we all have challenges in our business, this is a month late, but it's arriving tomorrow in my office, and we should be able to get this out to you early next year, like the first week of January. You should receive your physical copy of it, but you all have the electronic copy of these magazines. And in these magazines, you probably read the Road to $10 million. It's a 4-part series over the course of the whole year. Part 1, Part 2, Part 3, Part 4 on how to scale and grow your business to $10 million. And in all of those, I reference the Home Care Elite Academy. And those are my top clients. Those are the people I spend the most amount of time with. I visit all of their offices, and we get together. We have these board meetings 5 times a year where we go over best practices and whatnot. And so for this session here, what I'm sharing with you is from a presentation that I gave to the Elite Academy back in August of this year at one of the board meetings there, where we went over all of the numbers, all of the metrics, all of the key performance indicators, those good old-fashioned KPIs, and do it as an evaluation. And so I said, let me share this with all of you, my 179 clients around the world, so that at the end of this year, 2022, you know where you stand. You know, as you're planning for 2023, what areas do we need to improve? What are we doing better than the average? So that, hey, let's continue to do this because we know this is working. Hey, we're not so hot here. We got to improve here, so that it gives you the goal of being able to take care of more people next year, to be able to make sure that the profits are where the business needs to be. So you're able to scale and grow and hire more staff, give bonuses to your office staff, and do things that you're currently not doing, right? How do we continue to grow? It's through this constant reevaluation and almost like an internal self-audit. And that's what this webinar is about. And again, so if you are in the Elite Academy and you came to that meeting in Denver, Colorado, or the one in September that I did here in New Jersey office, you've seen this presentation, and it's still good for you to do it again because it's been 3-4 months, right? So you still have to reevaluate and see where we are, because we're always constantly reevaluating and coming up with ways for us to be able to improve our inefficiencies, because those inefficiencies, when they're improved, that could be a 500-hour-a-week jump, which is a 2,000-hour-a-month increase over what we're currently billing out, which could lead to $500,000, $750,000 in revenue more than what we did the year before, all from one area of improvement. And a lot of folks don't know what that area is without taking that 10,000-foot view, looking down at my business and tracking those KPIs. And so that's what this lesson is about. All right. So you see on the screen right here, the title of it, as I called it, was "The Numbers Tell the Story," discussion on KPIs. These first two are for you as the owner. Has nothing to do with the business, but it has to do with you. A big focus of mine for myself personally, and for all of the members of the Elite Academy, and for you, all my clients, is to make sure that we have work-life balance. I can't stress this enough, all right? Because without the work-life balance, what is the point in working? What is the point in owning a business if we are slaves to our business and we have golden handcuffs? Yeah, I make $1 million a year and I can't even go on vacation because if I leave the office falls apart. That's not living. There's no point in having a business like that, right? So the first two objectives here are to take a look at how am I doing as the owner of my business with my time spent and the revenue that I'm making, and also to put some perspective on things, all right? Because it's real interesting as we take a look at these two KPIs. So let's look at this first one here for a second, all right? This first one really jumps out to me when I see that the average CEO, business owner, I'll throw in there as a CEO, works 62.5 hours per week. This is not work-life balance. As you see, and this is straight from Google, you can Google search this yourself to get where I got this data from, right? But it even says within that number is significant variability, as some hover closer to 40, 50 hours, right? Which is where you should be. But many work well above 80 hours. And so just as a note to yourself, take a look at the last 3 months in your business and estimate how many hours per week you're working. If this is the average, you want to be less than that. All right? You want to be less than that. I will share with you myself that in a normal work week, I work less than 40 hours. That is my decision. That is how I run my business. My business is extremely efficient and optimized. On weeks when I travel, because I travel a lot for business, like next week, for example, not next week, next month in January, the first week of January, I'm actually traveling to 2 offices. So that's 2 trips. The second week, I'm doing 1 trip, but it's a long trip with flights and everything else because it's in 3 time zones away. And then the week after that, I'm doing an Elite Academy meeting in Las Vegas, which is also 3 time zones away. And that'll take me 4 days. So on weeks when I travel, I usually work more, but I balance it out by taking that last day of the week off. So I still give myself that work-life balance. I have time with my family, time with my friends. In this case here with the 1 in January and the 2 in January, the first 2, they happen to be in destinations that are near mountains, and I am an avid snowboarder, so I am taking off the day after the training, and I am going snowboarding on the mountains with the client that I'm visiting. So that does not count as work because that is playing hard with work. But again, I give myself 40 hours a week. If I was an employee somewhere, I would work 40 hours. So I don't want to work more than 40 hours in my business. And I shouldn't work more than 40 hours in my business, and neither should you. Here's the exception to that. If you are in your first 3 years, because anybody who's been around for a while who is successful will tell you the first 3 years in business are the hardest 3 years. You literally are creating life. Right? You are breathing life into your business, this inanimate object. We are getting patients, you're getting caregivers, you're getting office staff, you're training them, you're developing them, and you're getting it so that it can run independently of you on its own. That takes time. There's another way to look at it. The government references this, and I only know this because one of my buddies works at the CIA, and so we have these conversations every once in a while that when you're having some whiskey or something with your buddy who works for the CIA, we have the do not repeat this, and then we have the that's classified and I can't answer that question, right? So this is part of the we can talk about this, right? CIA question. And this is where the CIA actually took a look into studying people who are like the best of the best at what they do. And this the one thing that all of these people who would be considered world class, like an NFL athlete or a musician who plays at Carnegie Hall, like the best of the best in their respective industries, the best of the best, in their industry. All these people, right? Why are they so successful? And what the government has realized is that there's a magic number, and that is when you, any one person, puts 10,000 hours of time and effort and energy into doing one thing. That is when you become a true master of whatever it is you're doing. So in this case here, why does it take you 3 years to become successful? Because that's how long it takes to put in 10,000 hours of work towards growing your business. So that's just as a metric for you. So those of you out there who've been around for a decade, you're like, yeah, I can work 40 hours a week. That makes sense. And if you're not, that's a problem. Talk to your coach, talk to us. We can help you get that work life because you shouldn't be working more than 40 hours a week after, the first 3 years. But if you're in your first 3 years, you got to get past that 10,000 hours. That's when you have enough experience to have gone through so many different scenarios that training can't prepare you for, right? We've had some crazy things that have happened to all of us. I people, lawsuits, workers' compensation claims, clients getting mad at you, threatening you. All the things that happen in a business will happen to you for the most part in that first 10,000 hours of you running your organization, and that's the magic number. So if you're past that, you should be able to work about 40 hours a week. And so that's why that's my first KPI that we're reviewing here. All right, the second KPI, and this is the one that makes me sad, but it is what it is with good reason, and I will explain it, is understanding that the average small business owner, meaning somebody who has a business that generates less than $5 million by the government IRS standpoint, that is a small business. Another way of looking at it is somebody who has fewer than 50 full-time employees. Those are small businesses, all right? The average small business owner in the United States makes just about $72,000 a year. And 86.3% of small business owners make less than $100,000 a year. And if that is not perspective, then I don't know what is. Every time I personally have a moment of complaint or frustration, I'm not making enough money, blah, 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 blah. I'm human. I have those moments just like all of you do, right? You know, and I'm sitting there driving a $100,000 truck, the $90,000 Tesla, and I went on a $30,000 vacation to Europe over the summer, and I'm complaining about not making enough money, right? And I put it in perspective, and it's like, you know, I make a well over 100 grand. I make a lot more than 86% of my peers who own small businesses. You know, that's perspective for you. Now, if you are a business owner that's making less than $100,000, this is why you're working with us. We're going to help you scale and grow your business. I want you to be profitable. You know, when I think about the Elite Academy, without getting into individual specific people, but the average person in the Elite Academy is making like $400,000 a year. Easy with how much we're helping them to be able to scale their business and what we're focusing on and everything else or whatever. So, you know, it puts things into very real perspective. And this is also a true thing too. And I want you to give yourself some kudos on this. All my business owners out there, every one of you, you see this stat here. If 86% are making less than 100,000, well, how is that be? Why, Steve? Why? Well, realize this. In the United States of America alone, there are 27 million, all right? 27 million small businesses. 25.5 million of the 27 million generate less than $1 million in revenue. So if your business is generating 800 grand, yeah, you're not going to make 100 grand, especially if it's in the first couple of years, in most cases, right? So that's the reason why the income is so low, because most business owners are not generating $1 million. So I want you to, again, this is a KPI. To performance indicator for yourself. If you have generated more than $1 million in revenue this year, congratulations, your business is bigger than 25.5 other million small businesses in the United States. Just put that in perspective. And that's why I am throwing this out there to you as a startup. These are the first two for owners, right? How much time am I working? How much am I making for myself at it? And the reason why I start with that is because if you own your own company, you did this for a reason. And one of the reasons, yes, you want to take care of everybody. I told you, I pray over you every day that you take care of people, right? So at the very beginning, right? So I know that's why you started this business, but you could have started any other business, but you started a business so that you could make a living for you and your family. And this is how you make a living for you and your family. And I'm here to say that you should have a living with it, and the living including time to be with those that you love, so you're not working to death, and income so that you can afford to do the things that you need to do for your family, such as put the kids in, you know, summer camp, give them a good experience, show them what it's like so that they have more than we had when we were children, right? Be able to help your elderly parent who can't take care of themselves. You know, I'm just sharing some things personally that I do, right? And give back. You know, that's a beautiful thing when you have the abundance, right? So just take a look at these KPIs for yourself. Moving forward, we're going to shift the focus here now to some business KPIs. Client census growth. This is very important because this is home care pulse data. The new report is coming out next year. You will be receiving, we will send it to you, but Home Care Pulse is also going to be receiving it. They sent me an email today asking me to encourage, once the link becomes available in January, to encourage all of our clients to take it. I want you to, even if you're not a subscriber to what their services are, that's fine. You don't have to subscribe. But the more data we have at Home Care Pulse, myself and other people who support you, the home care industry, we can better provide what you need to be able to grow your businesses. Home Care Pulse partners with the Home Care Association of America and other organizations to be able to get the government to make it easier for you to run your businesses. So that's very vital that you participate in this study. So when it's available, we'll send it to you. But I like showing you this because this shows you that over the last, 6 years here, there really has not been much client census growth year over year. So a 5% growth, just putting it in perspective, if you were servicing 100 patients in 2019, 5% more in 2020 would be you're serving 105 patients, right? If you were serving 100 patients in 2020, 7% more mean that you're serving 107 patients in 2021. And so that was the rate of growth from year to year. So let's just use 7.3 as your rate of growth. So what you're going to calculate for yourself is, what was your client census or your average client census, right? You see median client census from year 1 to year 2. So on average, you take how many patients you serviced in 2021. Say you serviced 150 clients, right? And then you divide that 150 by onboarded, discontinued, whatever. Yeah, divided by 52 will give you your average census for the year, right? And then if you were to do the same thing the year after, the difference should be 7%. All right, so whatever your average census was, say you signed on 150 clients, forget the dividing because there's no math right here. You serviced 150 clients in 2021. This year, you service 175 clients. The difference is 25 clients, which is going to give you a rate of growth of around 12%, 12.5%, right? That's what that example would be, and then you would report that and take a look at it for yourself. Industry average was 7% more. You want to be on the higher side. That's where you should be. If not, then you need more sales and marketing effort in 2023. All right, so let me re-explain that. Total number of clients serviced in 1 year, 2021. Total number of clients serviced this year, 2022. What's the difference? There's your percentage. We want it to be greater than 7% because that was the industry average coming in. If it's below that, next year, we have to put more of an emphasis on marketing and sales. If it is above this, say it was 12% or 15% or 25%, as I know many of you have, because many of you are working with us and we help you to do your sales and marketing, then you're doing everything great and continue to go. You don't need to adjust that in the new year. That's what this metric tells you. Moving on to the next metric, the revenue. Now this right here is where I love Home Care Pulse. And I actually had a conversation with Todd Austin, who in the most recent magazine, Home Care Revolution Quarterly, right, the one that you all received electronically, he actually wrote the top 3 KPIs you need to improve for your business to thrive. You all have access to this. It's our website, homecarerevolution.com/magazine archive, and that's where you can read the magazine, all right? When you look at this, he goes over the KPIs that you need to be able to grow. But Todd Austin, this guy right here, he's a good friend of mine. So I was talking to him earlier this year after the report had come out. We were going over some of these numbers and studies. And I said, I love the way you put this, where you show this 4-year trend, and you say that the industry revenue has grown by 7% over 4 years to make it look better than it really is. And he said, why do you say make it look better than it really is? And I said, well, really, year to year, that is not exciting, right? So $1,642,000 to $1,664,000 is $20,000 difference, which is like 1.1%, 1.3% revenue more, right? That's not really exciting. And he started laughing when I said that. I was like, yeah, if this is what people average in 2020 and this is what people average in 21, that's more exciting because that's significant. But this to this and this to this and this to this, These aren't exciting revenue growths, all right? So good news, all right? Look at what you did in revenue in 21. Look at what you did in revenue in 22. Add them up, right? Divide it out and get your difference by percent. As long as you did 2% revenue more in 22 than you did in 21, you're well above industry average. But really, what I want for you as my client, who I've worked with, if you've gone through the university, if you are a coaching client or greater, I expect you to do at least 10% more revenue than what you did the year before, which is 10 times the industry standard. My clients average 36% revenue. So when you do that, if you didn't do 10% or greater, let us know. If you're a coaching client, let us know if you're in the Elite Academy, because we're going to make sure we're on top of that. If you didn't do 10% or more and you're not one of those clients, I would consider, and I'm not trying to sell you, but I would consider you moving up into a higher level of working with us, because I know our coaching clients average a 36% revenue increase over what they did the year before. Imagine you did 1,664,000 in revenue and you did 36% more than that the next year, which puts you at like 2.2, right? 2.4. That's significant. That's what our clients average, and that's what I want you to do. So check your numbers. This is industry average. You should do, being our client, you should do at least 10% more than you did the year before. And really, if you're a coaching client and you're getting coaching every single week, your numbers should be closer to 36%, because that's what most of our clients average. All right, just sharing that metric with you. Moving forward to office staff and office staff salaries. There's not much to get into this too much, except for the fact that you see the ranges here. Let me see if I can zoom in this a little bit closer for you. Of course I can. I got my cool touchscreen computer. I love to complain about it, right? This stupid computer, blah, 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 it's a touchscreen. I literally expanded it right in real time, right? Complaining. It's so funny. All right, so skip the active owners for a second there. You guys are important. We already talked about you guys with your income and if your revenue is doing, and that's not including your profits passing through. This is what active owners are paying themselves. But executive management. If you got executive directors in your organization, if you have administrators, high-level people who are there for you, this is a primary focus of the Elite Academy. I'm so proud of the Elite Academy clients here, because, and I'm not bragging, but I am bragging, right? Good job, Steve, but good job, you Elite Academy clients. Why? Because a lot of you started working and became part of the Elite Academy because of that work-life balance I mentioned at the beginning, because a lot of you are like, hey, I'm making all this money, I'm working with you guys, but I'm working my tail off and I never have a day off. And every time I leave to go on vacation, my office falls apart. And I'm like, you need an executive director. Join the Elite Academy. Let's get you an executive director. Let's train the executive director. And you hire this person who, yeah, it costs you money. I mean, look at the average price of an executive director. It's $75,000 as an average salary, right? And look at the ranges. I'll explain that in a second. But, yeah, that's a big salary. But it's worth it because you now have somebody else who can run the company independently of you, which makes your business more valuable. If you want to resell someday, it allows you to have freedom and flexibility so you can go on vacation. I'm so proud. I have a client in Texas right now who's going on vacation for a month because they have an executive director, and so they can go on their first vacation in 3 years, and they're going to be gone for an entire month, husband and wife and kids, and have a blast, because there's an executive director to run the business, and the business isn't going to fall apart while they're out of the country, right? My company didn't fall apart when I was out of the country in Europe for a month, and the same thing should happen for you too, right? So executive director gives you that balance. It also gives you somebody else who can help and scale and grow the business. It's worthwhile, but just look at the revenue ranges. Now, the one thing that I'll point out here as I move over, just to kind of give you a quick reference, All right, each of the colors represents a different revenue level. So if your business is, say, doing, $3 million, that puts you at this dark green level here. So executive directors of $3 million to $5 million agencies are making about $90,000 a year as a base salary. If you're a master, meaning your business is doing over $5 million, those executive directors are making about $100,000 as a base salary plus bonuses and commission incentives on top of it. Think about it. An executive director of a $6 million agency should be compensated like that. You want them to run a $6 million business? Yeah. 100,000 base salary plus bonuses and commissions when they're growing the organization, they're making 120, 130, $150,000 with all of that when they're doing it. And that's worth it because you, as the owner of the company, you should be making $1 million a year, right? So these are all things that you can do when your business scales and grows. Why am I showing you all of this? All right, administrative staff, payroll, billing, secretarial, HR, all that good stuff, right? These are the ranges in salary based on where it is. $1 million business is around 40 grand. A $2 million business is around 45,000. Even the $3 million business doesn't really start to go up until they're around $5 million, where you're paying people $50,000 on average for this type of a position. Part of the reason why the salary goes up with the revenue is because of volume. Right? Think about how many times your phone rings, and imagine if your business was a $5 million business. If you have a $5 million business, you know how many times a day your phone rings, and that's the reason why you're paying that person who answers it more than you would if you were $1 million business. So it all goes accordingly, as well as you also have to imagine people who are loyal and they stay with you for the years it takes to develop and grow your business. And so if you got someone who's with you for 5 or 6 years, I'm going to say they better be making over $50,000. Why would they stay with you for that many years? Obviously, because you're taking care of them and they're growing with you and your business is growing and so on and so forth. Marketing rep salaries, all right? This is base salary, but look at it. It's all $55,000. That's right on the cusp here. The only one that's higher are the leaders. And again, I'm just gonna go out on a limb here. This lady right here, all right, she's a master. She's one of my favorite clients. Many of you have heard her speak at conferences, and she's even done webinars for you as part of the Home Care Evolution Daily subscription. So Franny's marketing reps, they don't make that, and I don't have to go on record and say that because they would say that themselves, right? They would not work for that because of the volume of work that they have to do. So I want you to put it into perspective, all right? When it comes to sales and marketing rep salaries, if you have a marketing rep who's bringing on 3, 4, 5 inquiries every single week, that's 150, 200 inquiries a year. That is somebody who is worth more than this, and somebody that if there's something going on, they might get poached, and that's what happens. So this is the one category that I will tell you, owners, be careful, because if you have a rep who's out there bringing in that kind of revenue, an assisted living, a hospice, a skilled nursing agency, they're going to offer them significantly more, and they're going to poach that rep, and then they're going to go work for the other company and make a lot more money. So you have to be careful with how you compensate your reps. I'm fine with giving a rep a lower salary to start and giving commission incentives on top of it, but you got to keep the people. And I'll just use myself as the example. All right, when I first started working, and look at this, I'm very nostalgic. Let me shut this off for a second, right? Care Choice, that's my company, all right? I became the vice president, part owner of Care Choice Home Care Company back in the day, all right? Our main office was Monroe. We eventually added a second office, Howell, but this is what we were doing, and Brian made me his business partner. Well, my very first year in the job, I started August 15th, 2005. In 4 months' time, I got to a point where I was averaging 3, 4 referrals every single week. We were growing the business. We only had 16, 17 clients on our census. By the time Christmas came of that first year, which is only 4 months later, the census had doubled. You know, we had 30 clients on our census. The revenue had doubled. I brought in all this business. Now, my commission, I was making good money. Don't take me wrong. I had a 45,000 base, which is low even by the standard, but this is 15, 16, 17 years ago. But I had a 45 base with commission incentive. With my commission incentive, Brian had projected in my first full year, I was going to actually make 55,000. Which at the time, with what I was making at the time coming in, I was 24 years old. This was my third professional job. I had 2 jobs prior to, and that was what I was looking for in an ability to earn. But I was exceeding that, and so I was actually projected to make 65 on my commissions because I was exceeding his expectations. So while me exceeding his expectations, this is what you want to take away as the business owner. If you're somebody who's exceeding expectations, you don't want to lose. Why do you want to lose that person, right? You want to pay that person and keep them and get them out there exceeding expectations and keep growing a company. But I was getting job offers, all right? I was getting offers from assisted living communities and hospices and home health. I received 4 job offers in the month of December of 2005. And the highest offer was for an $80,000 base. So here I am making 45 base plus my commissions, and I'm getting offered an 80,000 base. That's a $35,000. That's almost 90% more of a base on top of what I was already making. So did it cross my mind to leave? You bet it crossed my mind to leave. Did I leave? Obviously not. I became the owner of the company eventually. But Brian said, there's no way I even want you to even entertain the thought of it. January 6th of 2006, literally that first week back after the break, he sat me down. He gave me a review. He gave me a raise, and he bumped me up to $85,000 base. $85,000 base in my not even second year, but the beginning of the second calendar year. But really, it was at the 4 months. He gave me that much of a jump in base because he didn't want to lose me, because he had been through 3 other marketing reps where that had happened and they weren't as productive as I was, and he didn't want to lose me. And so he gave me that base, and then he showed me a projection where I was going to make 96,000 that year had I met the goals that he was setting for me. And guess what? I made 105,000. So I exceeded my expectations again. How happy was Brian? Well, he had $1 million business in his first 4 or 5 months of having me there. He broke $1 million for the first time ever. In my first full year, though, he did over $2 million. He made 400 grand. So to give me that $105,000, he had no problem doing it because he made the money, right? It was the right person, the right investment. So what am I sharing with you? I'm sharing a very real story. This is my story, right? That doesn't happen, Steve. It does. It happened to me, right? That's why I'm sitting here now 17 years later. But don't let that happen to you. Don't let your rep get poached. If they're the right person, I just gave you the metrics to take a look at. If they are the right person, make sure that they're compensated accordingly so that you don't lose that person, because losing a marketing rep when they're a good rep really takes a hit to the business. I want you guys doing 2,500, 3,000, 4,000, 6,000, 6,000 hours a week. You know, another person who's doing 6,000 in the very first magazine, my very first client article that was written, this guy right here, love him to death. He and his wife, this guy, Tom, outside of Washington, D.C. And know it can be done, right? You can do this too. Just trust me when I'm telling you these KPIs, all right? Moving on. Schedulers, Schedulers, all right. Client care coordinators, not the field care coordinators, but the client people who are working with the schedules. You see the salary range here? I'm just going to put it out there. Looking at the masters again. I got a client in upstate New Jersey here, about 45 minutes north of where my office is. His schedule is making $75,000, $80,000 a year. Why am I throwing it out there? In his eyes, he told me that his scheduler, who makes $75,000, $80,000, schedulers, he's got multiple schedules, crushing it, great, 4 offices, everything. He told me that the reason why he's paying more for the schedulers is because his $80,000 scheduler can do the job of 3 $45,000, $50,000 schedulers. The work volume that she can handle, that they can handle. And the way that they get the job done, and they're not managing 30, 40 clients. Like most schedulers manage about 30, 40 clients, and need a second schedule. They're managing like 100 patients, right? you pay, so you get what you pay for. In all salaries, you get what you pay for. Even myself, my average employee makes $75,000 a year. My average, get that what I just said? My average employee makes $75,000 a year. That means there's a lot of people making more than $75,000 for that to be the average, right? Why do I say it's actually probably closer to like 80,000 with everything that's going on? Why am I saying that? Because you get what you pay for. Many of you have told me over the years, Steve, I love your staff. Your staff are amazing. Man, I wish my staff was half as good as your staff. And my staff is amazing. They can do any, I put so much work on those ladies and they get it done. They are phenomenal. And the reason being, yeah, they're worth every penny of what I'm paying for them to be able to do the work that they do, you know. And I'll throw it out there too. It's pretty cool when your staff are able to go out and buy a house and all that stuff because of what you've done for them and what the work they're doing for you. It's cool when that happens. So keep making that happen, all right? Field care coordinator, same thing. You see this right here. The bigger businesses is paying more. Again, that's because they're managing a higher volume, all right? But field supervisors. So again, what do I do with this, Steve? You want to take it, you want to make sure that you understand it, you got it there in front of you, and compare where do I measure up versus industry standards, and am I getting the return on investment like you're discussing here with you. I hope this is good. I hope you're getting a lot out of this, all right? There's still more to go. I see, good, more people have come on. This is excellent. Good. Even more, yeah, more people are here on. Oh, this is awesome. I love it. I hope you're getting a lot out of this because this is very, very high level stuff we're discussing here as you're looking through your KPIs and comparing where do I stand versus what are the industry average at the end of the year as I'm getting ready to move into next year. If my numbers are worse than the industry average, I got to improve in this area next year. If my numbers are better, continue to do what I'm doing, and I don't need to focus on that in the first 3 months of 2023. Just looking at office staff size, while we're staying on staff for a moment here, how many people do we have working for us? Well, if my revenue is under $1 million, it's probably 3 people, including me, and I'm one of them. If I'm doing about $1 million, $1.5 million, I got 4 people. We'll say 3 people still. Look at this, is identical. All right. If I'm doing about 2 million to 3 million in that range, 1.5 to 3, I got 1, 2, 3, 4, 5, 6. So 5.5, including me, right? Because this is me right here. So just noticing it, right? Notice where the revenue is. Notice what positions are missing. All right. You go over here. All right. I got to add, now I got a full timer. So I got 1, 2, 3, 4, 5, 6, 7 plus me 8 until I got $5 million. And then all of a sudden the numbers jump when I'm doing over 5 million because it takes that many people to manage well over 100 patients and 150 caregivers and the recruiting effort and the marketing effort and everything that goes accordingly with it. The one thing I want to point out is the care coordinator position, which is the field supervisor. Most agencies wait until they're doing like 2 million plus before they invest in that position. That is a position of need. Invest in it early. I cannot stress this enough. This is 66%, 2/3 of the home care special ops class, which is part of the Hurricane University that many of you have invested in, is all about the care coordinator, field supervisor position, the responsibilities, the job description, the how to do it, and everything all in special ops. I say this with no ego. All the clients who have been through every single one of my classes, Fast Start, Advanced Training, Special Ops, and Momentum, every single owner has told me that their favorite class of them all was the Special Ops class. As a matter of fact, I'm going to go and pat myself on the back. 2021 was the first year where these 2 levels even had a field supervisor. Prior to that, everybody waited until they were a $5 million business. The reason why I'm patting myself on the back is I'm working with 179 of you active right now today, right? I've worked with so many clients over the years that now so many people surveyed have a field supervisor at these lower levels. But I will tell you that when you have somebody who's supporting your caregivers in the field, who are supporting your patients in the field, in their houses, that leads to increased client longevity and caregiver retention. Those are two huge metrics that will allow you to scale and grow your business. There are many members. My favorite member of the Elite Academy, Rick Jones, he knows it. And I've given him all the, I've asked him so many, and he says, yes, you can tell everybody. Arkansas, love the man, right? Many of you came to Tampa a couple weeks ago. You met Rick, he was there. He went out and invested in the care coordinator position before he had the revenue. As a result, for 3 years in a row, he was the #1 percentage revenue growth in the entire Visiting Angels franchise. So we're talking about there's 600 plus locations of Visiting Angels, and he was the #1 percentage revenue growth for 3 years in a row. And he says every single time he wins the award, it is because of Steve's program, specifically the special ops class, and adding those care coordinators, because he's able to keep clients on services longer, and he's able to take on more clients and grow the census, and therefore the revenue grows, and you have better outcomes, and caregivers want to work where they get the support that they need. So that's why I'm taking the time to mention it, because that's a thing that's an anomaly that not everybody's doing. But when you do it, it results in significant revenue growth to your bottom line. Moving forward, all right, now let's talk about caregivers, all right? The $64,000 question, the pink elephant in the room, right? Steve, our caregivers, we can never get enough. After I hang up with you guys, I gotta call a client, right, who's going through, guess what? She can't get enough caregivers, right? Because we're all going through this, right? It's like, okie dokie, here we go, the same old thing, right? We're all going through it, right? We're all going through it. But recognize this. This is where you're looking at your numbers, all right? What does it cost you to get a caregiver? Notice the trend. The bigger as your business grows, it costs you more and more money to get a caregiver, and then all of a sudden it goes down once you're in that $5 million range. What is the anomaly here? And I'll tell you. Here, when your business is smaller, you, the owner of the organization, are doing a lot of the recruiting yourself, and you can convince people to work for you a lot better than your staff can. Over here, this is when you start to pass the responsibilities, because when you have 50 to 85 caregivers working for you, you can't do it all. There's just not enough. You got a recruiter now, and she's doing it. But your systems aren't quite ironed out yet. And you're still kind of figuring it out, because I will tell you that this area here, the 50 to 120 caregiver range, this is when your businesses go through a transformation. I'm going to take the screen away for a second here. Your business goes through a transformation. What is that transformation? The transformation is, in the beginning, it was a mom and pop, right? It's you, the owner, maybe 1 or 2 other employees who are staff members, and you're managing your patients and you're doing it all yourself. Once you get to a point where you have 50 or more caregivers, all of a sudden that business starts to go through a transition where now all of a sudden mom and pop mentality and operations and systems aren't going to get you to the next level. And you have to start to transition to corporate. This again, and I keep going back to the Elite Academy, because this is what I spend the most, like when people ask me, what are you doing at the Elite Academy? This is where I'm spending a lot of my time at the Elite Academy, is helping these people transition. So I got a $2 million business. I've been at $2 million for 3-4 years. I can't get past $2 million. I can't get past $3 million. What's going on, right? It's you're running the business like a mom and pop, and it's not a mom and pop anymore. You got to transition to more corporate. You got to start siloing responsibilities. You got to start having divisions and departments in your organization, and then staff for it, and becomes more systematic, right? So that's why the cost goes up in this level here, because this is where you're starting to figure out your processes to remove you from the day-to-day as you're scaling and growing, and get better at recruiting, and get recruiters who are better at interviewing. And you're investing in training with companies like mine. You're investing in software. You're investing in recruitment platforms and all these other things. All this stuff happens as your business is in this range, which is why the cost per caregiver goes up. And then by the time you get here, the cost goes way back down to what it was when you were small, because now you've mastered those systems, you've mastered those processes. And one other thing By the time your business gets this size, you now have a reputation. And people want to work for your business because you are the business of choice in the area. So that's why there's such a huge gap in revenue. So when you look at where your business, how many caregivers on average are you employing, and then what does it cost me to get one caregiver, that's how you figure that out. So if you're in this range and you got about 100 caregivers and you're spending less than $690 rather, I'm sorry, $690, you're spending less than that, great. Don't change anything. You're spending more than this, you need to make changes. If you're over here with, say 65 caregivers and you're spending more than $600, you need to make some changes next year because you're spending too much. If you're over here and you're spending more than 500, what's going on? You got a big agency. Why is it costing you so much? You got to take a look at those operations. That's an area of improvement in 23. All right, moving on down here, just for sake of time, because I'm getting close. I got to start wrapping up here. I got 2 more after this slide, so we're good. But I just want to speed up a little bit because I want to be mindful of your time. I want you to get back to what you got to do too. And Christmas is coming, Steve. Why would you do a webinar the week before Christmas? Are you crazy? I love you guys. Remember, I pray for you, okay? I said at the beginning, I'll pray for you, okay? I love you guys. I really do. I hope you're having fun with me, all right? Median caregiver turnover rate, all right? You see it. Again, why is it higher in this range, but it's lower down here? Again, it's systems. Here, the caregiver is working for you as the owner. Here, they're reporting to a manager who may or may not know what they're doing just yet. You're still figuring out your systems, and it's not the fault of the manager. It's just you're literally trying to run the business the way it was when you first started it, but it's at a size where you need better systems in place. And it's in this range here, the purple range, where most people start to invest in the training and the systemization of their organization so that it makes it easier, so that going forward, it's just process. And my buddy Caleb, who I believe he wrote an article in this issue here, is right in the beginning. No. So go to the Q2, right? The summer issue, and you can read KPI Caleb, one of my favorite clients all time, just a beautiful man. Like his soul is just so pure. KPI Caleb, 3 ways to protect your home care business no matter what the economy is doing, all right? This is who I call KPI Caleb. He was at the Tampa meeting a couple weeks ago. We had an amazing conversation, talk about all the things he's doing and how he's added all these levels of services for his clients and stuff, but he knows systems like no other, and he talks a lot about systems in his article that he wrote earlier this year. So you can go ahead and find that if you find that you have a lot of caregiver related challenges or growing pains of scaling and growing your business and systematizing. Take a look at that article and give you some good insights from somebody who's doing it real time like you. Okay, I just want to again give you references for things that you all have access to. Right? I truly mean, like, more. I'm praying for you. Let God help you where I can't. And then let God tell me how to give you the guidance. I've given you all of this. This is where you can find it, right? So now let's go to conversions. The last 2 are sales marketing related. Conversion ratio is everything, all right? If you're bringing in inquiries, you got to convert them to paying customers. This is an area where most people are lacking. As a matter of fact, I will tell you this, 22%, even 27 and 30%, these are not good numbers. As industry standards, these are not good numbers, all right? Now look at this again here. Look at how this area here, 800,000 to 1.6 million, right? So this is the $1 million range. They got a good conversion ratio of about 33%. It says 34 exactly, right? Which is 1 in 3. So if I get 3 inquiries, I'm going to sign up and start 1 client. But then it drops. It's the same thing here, right? The reason why your inquiry training and stuff is so poor is because you're figuring it out. You don't know how to close a client yet. You're walking into class, you're a client's house. You're trying to. and forgive me, I love you guys, right? But when you're first getting started, right, you don't know what you're doing yet. You know this, right? You're trying to sucker somebody and they're signing up with you for services, right? And you do, right? And you convince that poor person, right? And they sign up with you. And what do? You love them to death. That is exactly what you do, and you know it. So I'm not making fun. I'm just calling it what it is. When you're beginning, you know you don't know what you're doing, and you're trying to talk to somebody, trying to get them to sign up. That's why the conversions are so low. Because the family's like, do you know what you do? No, we're not going to sign up with you, right? But then by you get over here, you got a good system, and you know, because you're at $1 million, you've been doing it for a while. You've taken care of a lot of people. You can pre-tell about all the challenges they're going to go through. You can safety-proof a house. You can do all of that stuff now. So now people feel more comfortable giving you the kind of money that you're asking for, because I know you're all asking for $30, $40 an hour, right? So you can convince people to do it, and you got better processes here. But then all of a sudden, at these two levels here, it goes back down. Why? Because you, the owner, aren't doing it anymore. It's as simple as that. And that's where, again, the systemization of your business, having those systems, those processes that can make it so that someone else can close at the same ratio that you close. Handle the inquiry when it comes in on the phone or it comes in on the internet. Schedule the appointment. Go out, sit down, and sign the patient up and get them to start services with you. All of those are processes that get developed here at this level. And then by the time you're a master, boom, you're at 42%. All right, and part of the reason why they're at 42% is systems, and the other part, again, is reputation, because you're taking care of the majority of people in your marketplace, and people want to go with you, and they don't care how much it costs, because they know that you're the best, because everybody recommended you, right? So that's what happens. So now for those of you, Hurricane University, coaching, home care elite academy clients, those levels, make a note. Advanced training, you know that class that you skipped, right? Because everybody skips advanced training. I don't know why, but everybody skips it. But this is the class where you get the biggest transformation. Everybody who does advanced training, their business grows by $1 million, $2 million when they do advanced training, right? So here I'm telling you, if you skip advanced training, take advanced training, and you'll grow by $1 million, $2 million, right? It's advanced training, lesson 3 and lesson 4. Lesson 3 is your inquiry management. Lesson 4 is your closing process and system, that when you bring that through the entire organization, you'll be converting at about 40%, which means that for every 100 inquiries that you bring in, you're going to sign on and start 40 patients. You bring on 200 inquiries in a year, you're going to sign up and start 80 new patients. 300 inquiries, like the average master, actually 400, they sign on and start 166 patients. And what I love about that, like you think, wow, 166 patients in a year, my goodness, that's 3 a week. It's not this crazy number, right? This is why the Elite Academy is so strong, right? It's 3 clients every single week. That's what that is, right? There's 52 weeks in a year, 3 clients a week. That's 156 to be exact, right? So a little bit more. Some weeks you're signing on and starting 4. But the other weeks you're signing on and starting 3, which is very attainable. And that gives you a $5 million business, right? It's amazing how the numbers don't lie. So again, conversion ratios, you want to be around 34 to 40% or better. If you're not at 40% or better, you need to work on that next year. If you are, you don't need to touch a thing and move forward with confidence, and you're going to crush your goals next year. All right, I told you where to find it. Advanced training, lessons 3 and 4. That's where you get the training on it. Come to those classes. Last one is your referral sources, the best referral sources. All right, just checking it out from a referral source standpoint for private pay customers. Assisted living communities, continuous care retirement communities, hospitals. The one that's missing that has been on here every year for the past decade is skilled nursing facilities. The reason why it wasn't on there, I guarantee, is because of COVID. And with COVID being gone, it was impossible to get into those accounts, except for many of my clients who were already in these accounts. So now is the time to get back into those accounts. So if you're not getting referrals from skilled nursing, assisted living, continuous care retirement, and hospitals, those 4 types, if you're not getting referrals from those, you want to get referrals from those because that's where the masters are getting their business, and that's how you're going to be able to scale and grow your business in 2023. So in closing, my friends, I will leave you with a proverb, and this proverb is in the Bible, and it is from the book of Proverbs 27, verse 17. And it is iron sharpens iron as one man sharpens another. It has been an honor. It has been a privilege. It has been a pleasure to serve and sharpen you all year long. I look forward to continue to sharpen you, to help make you better business owners, to help give you a better work-life balance, to help you to earn more money, to help you to get more patients to keep home and out of the hospital, to help you to get more caregivers, giving them a better quality of meaningful work, serving another person in 2023. I wish you all a very Merry Christmas, a happy Hanukkah, a happy holiday if you don't celebrate either of those two, and to all of us, it is my prayer that we all have a prosperous, productive, profitable, and flourishing 2023. May God bless you all, and I'll talk to you then. Take care, my friends. Bye for now.